Hello, everyone. Welcome to another episode of the Health Innovators in our special series where we feature innovations in healthcare and the people behind each of these innovations. I'm Donna Coriel, the creator of SoMeDocs, and excited to bring on yet another innovator. Today, we're going to talk to Dr. Adalbert Pilip. And without introducing him more than to say he's a cardiologist in the New York area, I'm going to actually let you introduce yourself and maybe give us a little background as to your training before we get into the innovation.
I appreciate it. Thank you, Dana. So my name is Adalbert Pilip. I trained at Monty. That's how Donna and I met, and for internal medicine. And then I did my cardiology at Stony Brook. I am in private practice. I launched private practice internal medicine cardiology up east in Long Island, and it's been fun. Seeing patients on a daily basis, giving my cell number away to them, because at the end of the day, I realized over years and years of training is that you can be a great physician, but if patients can't reach you, that makes things difficult. So, but we'll get into that shortly.
Wonderful. All right. So let's jump right in and talk about your innovation before we talk about the other being you. So tell us a little bit about what your innovation is and sort of why you came up with it.
So one of the things that I was compelled to do something different was, we all like getting new patients. As a matter of fact, a lot of us are very much focused on getting new patients. That's we feel like that's the bloodline of our practice. One thing that I've realized over years, after years of being in practice, is that even though we're all so focused on bringing new patients into the practice, we get to forget or neglect our established patients. We may get 5 to 10 new patients a month, but yet we get to hemorrhage hundreds of established patients out of our practice. And it is nothing specific to the doctor. Majority of us do great. Majority of us are well-trained and want to help our patients. The problem is that our patients don't have great connection to us, because once they leave our office, that's over, right? We rely on so much in ancillary processes to get us whenever they have questions, whenever they have a refill, whenever they want to see us, they are sick, they want to come in. So that's how we get to lose a lot of our established base, because they get jaded, they get disconnected. They feel like, wow, Dr. Pilip, you're great with me, you've saved my life, but once I leave the office, I could never reach you. And so that prompted the whole smart appointment, where, just like the name implies, it's all about being smart. We chase $1 and spend $100 in the contacts, right? We spend so much money in marketing. We become available by being great physicians, but then it's hard for us to do follow through. It's very hard for us to connect with these patients whenever they leave. We've done our own little market research where I've given out my cell number to 10, 12,000 of our patients, and it's amazing the kind of things I found out once people were able to just text me. Before the text number being publicly available, they would have to rely on the traditional methods, calling an office, leaving a voicemail. And then I realized that sick people couldn't get through. They had to go to urgent care. They had to go to emergency room. And it's because, again, my staff told them what they wanted to. My staff told them, you don't feel well, go to urgent care. I never said that. My staff said, you don't feel well, you need an urgent appointment, you feel sick, or well, go to the hospital. These are the kind of things that my staff took the liberty of telling my patients. And I never knew that until finally they were able to text me the minute my staff said something that was inappropriate. So Smart Appointment was created just for that purpose.
Wonderful. So you're sort of almost fixing the communication line between the patient and the physician to sort of get us closer together. Is that a good sort of summation?
Absolutely. We do it in a way where we automate the process. If right now Amazon can get you in a door, get you shopping and out the door without connecting with one live person, we wanted to do the same exact thing. When the patient downloads the app and puts the insurance information in, it's automated. That means that my entire staff can literally take a week off, and I can still book every appointment I wanted for the next couple of weeks. That's the premise. The premise is automation.
Gotcha. All right. Wonderful. All right. So we're going to have a lot of the innovation part of this on our website in the actual episode that this is featured in. So you could actually check that out. But let's talk about you. So people are actually interested in the actual innovators that exist under the white coat. So who are you when that white coat comes off?
It's amazing that whenever the innovation aspect of it or patient aspect of it is off, I have 5 little monkeys at home that they want is attention with mommy and daddy. So that's my full-time second hat. As soon as I get home, I have responsibilities where between the homework and between the soccer practices, you become an official chaperone where you're just driving all over Long Island, getting them practice to practice or fix their homework and so forth. So, that's me full time right after I come home.
Okay, wonderful. So you're a parent. Actually, so you answered a little bit of that, but run us through your day just because I think listeners sometimes are curious about busy physician's day, especially outside of clinical practice.
Yeah, no, absolutely. I try to make the process efficient when I'm not at work. And remember, I did mention my cell phone is available. By now, we have 15,000 patients. So if I don't structure my practice life properly, then just because I'm not at work doesn't mean that they don't bother me, right? My patients have access to me 24/7. So that means that if my processes are faulty, they will be texting me nonstop. Dr. Pilip, listen, I called your office. They put me on hold. They hung up the phone. They left a voicemail. So, one of the issues that's why it prompted this is to put the whole practice in proper channels of whatever something doesn't work well, you make it perfect. So that's one of the issues of trying to get the smart app work autonomously so that when I leave my office, I generally finish by 1 o'clock. When I get home, I want that cell phone to be quiet. I don't want anybody calling me. Now, it is available. People are able to text me, but if I fail my patients before I leave, that means that I get punished for it the entire day until the following day, right? So I am always motivated to just get it right, because if I didn't get it right, man, believe me, I'm paying the price all the way until the next day.
Absolutely. That makes sense. All right. Let's move on to sharing with us an interaction that you've had in life that has helped shape your current venture. So did anything in particular make you create this?
Yeah, so I love the idea of ZocDoc. When ZocDoc came out, when I literally just started launch my practice, I like the idea of getting new patients. Like I said initially, we all chased the new patients. So so that was the concept. I loved it. Now the problem came is that I get 10, 15 patients a month from ZocDoc. Half those patients just never showed up. So I was wondering, well, geez, I've missed opportunity. It was like 50 new patients. Jesus, half of them didn't show up. I felt like a failure. I wanted those patients. I was never able to reach those patients. Their numbers were not real, or they were not verifiable. Their emails were not real. Who are these half patients that never showed up? I always felt like, geez, that's a lot of revenue missed, right? So those patients I was never able to find. And then the other half of 15 that did come, half of those didn't have an insurance that was active. These patients come with insurances that never accepted, or I accept, but they were expired months and months ago, right? So all of a sudden now we had angry patients in a front reception area arguing with my staff, causing a scene in front of my established patients, saying, "Dr. Pilip, how dare you turn away the patient that really needs you?" But the insurance is not active, it's not available, and so now you're the bad guy. So I took the concept of ZocDoc, which made sense, but I wanted to fix a lot of the limitations of ZocDoc. Another example that really wanted me to make Smart Appointment work is I had one summer that I spent literally half the volume. My entire volume was, I usually see 30 to 40 a day, and I was seeing 10 to 15. I was like, wow, that's crazy. What happened to all the patients? I guess everybody left for the summer. And then finally, patients were texting me saying, "Dr. Pilip, listen, you've been away on vacation for the last 2 months. When are you coming back?" I'm like, wow, that makes sense, right? So my nurse took the liberty of telling every single phone call, and this is where your livelihood as a physician, if it's a private practice, your livelihood is entirely in the hands of people that you're paying $15, $17, $18, $20 an hour. They decide everything because you're busy running an office. multiple offices, and people out there make these decisions for you. You have no idea. If you don't give your direct communication, and I'll tell you right now, 90% of the doctors don't. 95%. They do not give their personal information as far as cell number. So they'll never know. They will have a receptionist. They will have somebody who says, nope, doctor's not available for weeks and weeks and months. Can you imagine if you took that away? If you took away that type of limitation from the patient experience, where all they had to do is get on the app, see the availability, and book it. Literally, I have patients that use Smart Appointment in my practice. They say, Doc, I love seeing you. I hate talking to your staff, but I love seeing you. So finally, we gave them the ability to see me when they need to see me without having to talk to my staff at all.
Wow. How is that? I mean, how do you get around the requirements that a patient visit requires that's maybe more secretarial?
So, if it's secretarial, we are able to now, there are other things that we've launched, so now we're able to have patients, instead of leaving us voicemails, which oftentimes you are at the mercy again of another employee checking through the voicemails. Now we have an option to have all of those messages directly get texted to us through a secure form. So now all of us have access to it, not one person, but now the entire office staff, including myself. So I know when something gets properly addressed or not, right? So secretarial stuff like my blood, my referrals, my stuff like that, we all have access at the same time to see that type of information. And so it's all about efficiency. Like I said, if I make something inefficient, I pay the price for it consistently.
Amazing. This is totally off script here in terms of the questioning, but has your innovation undergone several iterations?
So, one step before then, yes, we always aim at modifying, improving, building on top of things that we are told that could be better.
Right.
And one of the things we noticed with Smart Appointment is the volume. We've never been busier. There are offices out there who have closed. They haven't seen patients in a long time. They are so slow. Their business, they can't keep up with the overhead, so they have to close the offices. We have been the busiest we've ever been, because I think we're up 30-40% in our volume and revenue. As a funny remark, we were trying to apply for PPP, the loan forgiveness program, right, which we were able to get last year. And this year we said, why not, right? And the accountant comes around and says, hey, I have good news and bad news. The bad news, you don't qualify for PPP. I said, well, how come? He said, well, you've done too well. You've been too busy. You've generated too much revenue. You don't qualify. So, I mean, it's a wonderful news. I mean, you kind of said you couldn't get the benefit of the loan forgiveness, but what an amazing emphasis of a program that's autonomous, that works. We get 100+ appointments a week automatically made, where, think about it, interaction with an office, when an office has an interaction with a patient calling in, it could be 3 to 5 minutes if it's a simple, like the person knows exactly what they want to get in, get out. But those conversations could linger for 20 minutes, right? I mean, you have somebody who doesn't even know what the insurance card is. They don't know they don't know anything. And all of a sudden they're talking about their dogs and cats and their 20 minutes. Now understand, how many staff members can you really afford? And by the way, with the pandemic, we are down 70% of our staff, right? People have gotten COVID and never came back. People quit. We can't hire enough staff. And I think a lot of offices out there are feeling this right now. There's literally, this is the most shortage of staffing I've ever seen. We had 30 employees working for our offices, and we have 10. That is beyond ridiculous. So we can't, I tell patients all the time, listen, we want to do our best for you, but you have to also understand, we have a lot of patients and we almost have no staff left. So at least the autonomous process of having people's messages come through and having people book appointments and not having to talk to anybody and take the 20 minutes out of, can you imagine? You have severely limited staffing and then you take 20 minutes to talk to somebody. Think about it. You basically missed a ton of appointments. Those people that wanted to come in, they can't come in.
Absolutely. No, it definitely sounds like it can save you time and prevent some of that lag in terms of getting a visit optimally carried out. Okay, a little bit more about you. Tell us something that's interesting about your life, if there's any.
Gee, interesting about my life. Well, I did my medical school in Israel, and I think that's also some of the things that kind of gave us some commonality there as far as knowing people in the programs in Sackler and Technion. And so I'll say this, I did my undergrad at Stony Brook, but 4 years in Israel was really the best 4 years of my life. That's where I met my wife. And like I said, the education in Israel was amazing. Life in Israel, I mean, think about it. When can you take 4 years out of your life and just live in another country, especially a country that's so close to our hearts? The interesting part, my wife is, like I said, she's Israeli Ethiopian, and life has been nothing but a blessing since 2000 when we met with 5 kids together. Listen, this is what an American dream is. I come from Ukraine. I came here when I was 14, and so I guess we get to benefit a little bit of the American dream that made us come to this country.
Amazing. I could definitely relate. That's really special. Okay. Moving away from the seriousness, the question to you now is just short break. Are you team coffee or are you team tea?
Tea is very European, and I probably should be tea because that's what I grew up on. But I think coffee has been my thing, and so yes, coffee.
And any particular type of preparation or flavor or brand?
It's funny. I take black coffee straight.
Got it.
It's been Starbucks blonde, but it's just black coffee. Nothing.
Got it. My husband does the same. Okay,
Really?
great. He does. All right. Give us a resource. So it could literally be a book, a podcast, a TV show, but just something that you've seen lately that was good.
Interesting. My kids, in a very self-centered manner, they recommended for me to watch a Yes Day. I don't know if you've seen it yet. So Yes Day, it's very kid friendly because it tells the kids say, listen, you can't say no all the time, and it's funny, right? We all grow up to be carefree and we just do whatever, right? And then you have kids, and then everything is a no, right? So this movie is all about you have to say 24 hours for one day. You have to say yes to everything your kids ask you to do. And so it's quite a challenge when these little creatures want to kill themselves, obviously not intentionally, but if you let them run around without supervision, geez, I may have less than 5 kids at the end of the day.
It actually reminds me of a Jim Carrey movie or two. There's Yes Man, and there's also Liar Liar, where it's different, but right, he couldn't lie.
Yes,
so it's kind of similar. It was supposed to make him happy, and he was upset by it, but then in the end it made him happy. So
that's right. And the kid made him made him tell the truth.
Yeah, it was his birthday wish, right? That he could never lie. I mean, it's a classic. I love that movie too. We love it.
Yeah.
Okay. This one's important for us because I feel like every innovator has their pitfalls and their weaknesses, and you learned from it, but you can now pass it on to us and have us learn from the pitfalls you've experienced.
One of the things that, the pitfalls that I always wanted to account for, because again, at the end of the day, we always wanted to make an autonomous process, right? So an autonomous process just really, that's the key. There's a lot of calendar-based platforms out there where, ZocDoc is one example, right? You choose availability, you book an appointment, but yet somebody else has to do the job. Somebody has to confirm the appointment. Somebody has to verify the insurance, I guess, at the time when they come for an appointment. There's a lot of steps here that you've accomplished nothing other than captured an appointment. So we worked so hard. It took us a year to perfect an algorithm, right? It doesn't exist. We wanted an algorithm that would make it autonomous so that when you booked an appointment, you knew as a physician that you are going to get paid for that visit, because that's not always guaranteed. I get, before Smart Appointment, I get condolence emails from my accountant all the time, right? They're like, well, so sorry to tell you, another $5,000 to $10,000 that you can just write off because you've seen a patient that doesn't have an active insurance. Oh, well, you saw an active insurance, but you don't take that insurance, right? So test after test after visit. I've seen these patients sometimes 5 times in a month because they're complicated. There is a lot of stuff going on. And it would boil my blood, right? It was like, wow, my staff really doesn't care. So, and again, if you let your livelihood, literally, I mean, imagine this, right? Your entire livelihood, you are going to give somebody, and you say, control it. You are in charge of my livelihood. If I feed my family, if I have mortgage money, any of that stuff, right? You just let somebody you hired literally 2 months ago, maybe 3 months ago, or it could have been yesterday. You just hired them, and you're letting them completely run your life because that's what they do, right? You don't answer the phone, you don't make the appointments, you don't do anything other than be a good doctor. And that's what we learn in med school, right? We learn to be great doctors, but the support system, you're lucky if you have it. It's not always there. You think you do. If you don't give your cell number, I make a challenge here. If you consider this platform, give your cell number to all your patients for a few months. Man, let me tell you, the things you'll find out, it's going to disturb you heavily.
You mean about your staff?
About every inch of your operation, yes.
Yeah, no, of course. I think that this just highlights that it's hard to be a patient. Patients can be unhappy. I know we're highlighting the other side as well, because physicians, your point is that physicians, it's broken in the system. And so sometimes you're not paid, and because of the steps along the way. But wouldn't it be nice to smooth it out and sort of mainstream that process? All right. Last
management. And let me extrapolate just for 1 second.
Sure.
Reputation management, right? I mean, think about, I have docs out there who quit ZocDoc because it's too expensive, but it's still spend thousands of dollars every month just to keep their positive reviews. Smart Appointment also helps you with management of your reputation, because remember, patients that book those appointments and love you and they keep coming back because they're your patients, they are going to be leaving reviews on Smart Appointments. So now you have preferentially, so Google is who writes on Google and Yelp. People that hate you, right? They're not going to take the time to get on. I mean, very few do, but those that really take the time, they're mad, right? They are mad as hell, and they really want. And listen, a lot of times it's justifiable. I've read some of my 1-star reviews. I have 1-star reviews. I mean, I have 400 to 500 5-star reviews, but the reason I have that many 5-star reviews is because I pay attention to my 1-star reviews, right? I pay attention when I failed. And a lot of those times when I failed, I admit it. I say to the patient, listen, I agree with you. You are absolutely right. Because 99% of those 1-star reviews came from inefficiencies. Those inefficiencies that cripple the practice. I get it. I give them the value of understanding what they're saying. I give credence to their concern. I said, listen, thank you for letting me know. Now I know. And you know what? I even put my cell number on Google. On one of the reviews. As a matter of fact, every negative review, I say, here's my cell number.
Right.
I give it to my patients, but I guess you didn't have my cell number because you decided to write on Google. But here's my cell number.
I'm gonna guess that you are in a private practice setting, by the way.
Correct.
Right. I think that there is still a slight difference, and I think this makes sense to me for a private practice setting a lot more than like for an organizational setting where you're so far removed from the people that actually make the decisions that I'm not sure that this kind of thing would fit as easily.
For sure. When you're part of a big organization, again, you're just trying to keep your head above the water, right? You have a busy schedule, you have tested, you have procedures, surgeries, whatever. You just go. But guess what? It will eventually catch up. I mean, how many 1-star, 2-star reviews can you get before you no longer have patients? Right. We are in 2021. There's not one person who doesn't Google you. I have 30 to 40 patients a day, and I have maybe about half of them are new. 30% to 40% are new patients. And almost entirely all of them Googled me before they came. That's the only way they came to see me, because they love those 5-star reviews. And they appreciated the negative reviews too, because they appreciated how I respond to those negative reviews. So the point is this: yes, It may not be so relevant when you are in a big organization with 20 partners, but let me tell you, if you want to keep practicing and you want to keep seeing those patients and you want to keep doing those surgeries, who in their right mind, who would you, would I no, I Google everybody just like they do, right?
Right.
So if I'm about to get my cataract done and I read that you just terrible, oh man, I'm not getting my cataracts done there, even though it's a 30-minute procedure. So the bottom line is people should care. Everyone should.
Absolutely. All right. So last but not least, leave us with your ask. What is the one thing that you would want someone watching this to do for you that can help you and your innovation?
Thank you. I think that we are giving Smart Appointment away for free for now because we want everybody to understand the power of it. We want everybody to feel what I've been feeling, which is just pure joy of getting that click, click, click on my phone every single time an appointment is made and my staff didn't have to be involved. Let me tell you, the feeling of liberation I can't begin to give you, right? When I get 100 appointments confirmed a week between me and my partner, and those 100 appointments, people didn't have to talk to them, I'm elated. And I want my colleagues to feel that. I want them to feel that pleasure of knowing that they could have captured that volume of patients. They've done it for free. ZocDoc, charges you for every little single thing. We say, you know what? Yes, we are competing with ZocDoc, and we're not going to charge you. I want you to feel it. I want you to taste it. I want you to understand, because when you do, it's a pure addiction. It's beautiful.
Wonderful. All right. So what's the website? Although, again, this is going to be showing on our website on doctorsonsocialmedia.com or SoMeDocs.com. What's the quick website?
It's smartappointment.com.
Smart Appointment spelled out?
Yep. Smart.
Fabulous. All right. So everybody watching, check out smartappointment.com. Thank you so much, Dr. Pilip, for joining us. I wish you only the best of luck with this new technology and new app and your patients that have your cell phone number.
I appreciate your time. Appreciate the platform. Thank you so much.
Absolutely. You're welcome.